Hi guys, today I've got a really simple case for you. It's a simple class 2 div 2 case. The only thing different about this one is that we did it with linguals, and I'll show you what kind of complications we had and how we got around it, so I hope you enjoy it.
Okay, so let's go straight to the pre-ops, and you can see we've got a nice easy class 2 div 2 ortho case. She's not really she's not bothered about correcting her half unit class 2 canine relationship. She knows she's going to end up with a bigger overjet because these two teeth are just going to tip forward. And she didn't want to do anything with clear aligners. She's got a wedding, so we've got a deadline to hit. She wants it as quick as possible and as invisible as possible, so we had to go down the option of lingual braces. So let's go over to this. So the immediate problem here with this case was this tooth here. You can see that there's no way of bonding anything lingually on this tooth without sorting out these guys first. So we could have either used a removable appliance with some springs to push these forward and then bond up a lingual, but we just went straight in with a lingual and used some different kind of mechanics. So I'll show you that now. So this was my first attempt. What we've got here is we've got the wire. I think it's like a 12 night eye or something really skinny like that, and it's just it's going through these brackets like normal. Here we've got this blob of composite, and here we've got a blob of composite as well. And what this is doing, we've got this loop of wire here. What I was hoping is that this would put a force this way and this way, separating these two teeth out a little bit, which would inevitably end up with a tipping of that tooth there, exposing the lingual surface of this tooth. Now, you can see from the pre-ops that this did work a little bit. There was much more overlap before, but it didn't work as well as I'd wanted. I think maybe the composite blobs broke off or something. So let's have a look at my second attempt. Okay, here I was much prouder of this just because it's a little bit more involved. So what we've got here is some metal crimpable stops on the wire itself. So we've got one there and we've got one here. So what this does is the length of wire from here to here is actually longer than it needs to be. Alright, so if this was, if we took it out of the brackets and laid it on top of the teeth, the wire would be something probably a bit more than that. Let's start again. The wire would come out here, something like that. So this wire wants to really tip these guys forward like that. You can see that here we've got this excess wire, and that's causing this all to move forward. But in addition to all of that, we've got something else going on as well. We've got this piece of power chain which is looped on here, and it's actually attached to the tooth here, and it's stretched tight, and it just goes around like that. And what this is doing is putting a rotational force on this lateral. So we've got two things. We've got these incisors being tipped forward because of the spring in the wire, and we've got this rotational force on this lateral, which is going to help align this in a better position so we can actually bond a bracket on there. Good news is that this worked. So you can see in our next photo that the bracket is on like it's supposed to be, and from here it should be pretty much plain sailing to the end, but it wasn't. So we went through the normal prescribed wire sequence for this particular brace, and this is what we ended up with. This tooth is still a bit retroclined, and that one is a little bit as well.
Okay, so the way that the lingual braces are made is, first of all, the lab will do a setup of our final result, and the lingual brace is made on that. So here is a picture of the setup, which I should have checked as soon as it came in, but to be honest, I don't think I did, otherwise I would have noticed this. The laterals are actually still a little bit inset, and you can see this a little bit better on the occlusal shot. And let's have a look at straight front on. So you can see her upper left lateral is still a little bit inset, still needs a bit more correction, and the same with the right side. So this is totally my fault. I should have checked the setup before bonding up, but I didn't. So you can see the effect of this now.
So we've got two options here. We can either take off the lingual and finish off with some clear aligners, or we could try and be a hero and do a bit of wire bending. So I tried to do a bit of wire bending. This is the same appointment, so just a different photo of this same appointment. And if you look really carefully, you can see that there's a little bend in the wire here, there's a bit of a bend in the wire here, a bit here, and again a little bit here. And I'm going to exaggerate what this wire looks like, because these bends, I agree, they're really, really slight. So we've got the wire going out here, and then we've got a bend like that on the lateral, the incisors are here, and then we've got a wire bend like that. Okay, so I'm not going to go into wire bending too much. It is quite complicated. Well, it can be complicated, but essentially when the wire was nice and smooth, which is how we were anticipating the end result to be, and it was my fault, I didn't check it on the Kesling. On the Kesling, these laterals were a little bit retroclined, so the smooth wire did exactly what it was supposed to do. So I then put in this little bend to push the lateral out just a little bit more, and luckily this worked. So we can see, like, a couple of weeks later, this is our end result, and this tooth is in a much better position now. I was kind of preparing the patient for composite bonding and stuff like that, you know, just to finish it off, but luckily we didn't need to do any of that, and we can just see the result from a couple of different angles. She was really happy with the result. I think she may have even done some whitening afterwards. If we wanted an even better result, we could have done a little bit of gingival contouring, just raise it up a little bit there, make it a little bit more even. But to be honest, the patient wasn't really too bothered. She ended up with a great looking smile at the end of it, and she was happy, we were happy.
Okay, so I hope you got something out of that video. If you've got any questions or comments, please just write them below. I'll try and get back to everyone. If you've got any ideas on videos that you want me to do, mainly like ortho based, I've got a whole ton of cases to go through. Please, just let me know, and that will help inspire me on my next videos. If you did like the video, hit like, share it with your friends, and I'll try and keep them coming once a week. So until next week, take care.